Hi there, Talon. My name is Sydney. I'm a student nurse, and I'm going to be performing a musculoskeletal assessment today. So I'm going to test your active and passive range of motion of all of your joints, and then I'm going to ask you a couple questions about your mobility. Is that okay?
Yep.
Okay. So have you been experiencing any pain when you move in any joints or muscles?
No, I haven't.
Okay. And do you have a history of any injuries to any of your joints? Any muscle tears? No surgeries?
No.
Okay. All right. So I'm going to start by inspecting all of your joints to make sure everything looks good. It doesn't look too swollen. Okay. And your knees look equal on both sides. Can I take a look at your elbows here? Looks good. I'm looking for any signs of swelling here, like redness, inflammation. Okay, perfect. So I'm going to proceed by palpating each of your joints to feel for any crepitus or swelling or stiffness to make sure the joint capsules all feel normal. Okay, your ankles. Good. So nothing feels inflamed there. Check your elbows. Okay, and your wrists. They look good. All right, everything looks good bilaterally. Perfect. So now we're going to test your range of motion, okay? So can I get you to sit on the edge of the bed for me? Perfect. Okay, so first thing I'm going to ask you to do is raise your shoulders all the way up to your ears. Perfect. You can drop them. Okay? And can you put your arms out in front of you? Okay? And flex your wrists up, flex them down. Good, okay. Put them down. You can let your arms go limp, and I'm going to test the passive range of motion, where I move the limb for you, of your shoulders, okay? There we go. And we're going to try the other side. Okay, and now back to a couple active ranges of motion, where you do what I do. I'm going to ask you to lift your knee up just to touch my hand here. Good. Other side? Perfect. Okay. And now I'm going to extend your knee for you. All right? And can you point your toes for me? Can you flex them back towards you? Perfect. I'm going to put your knee down. I'm going to do the same thing on this side, okay? Point your toes. Good. And flex them back towards you. Perfect. Okay. Looks good. You can lay back down now. I'm just going to test your strength in your extremities, okay? So I'm going to ask you to put your arms out in front of you, okay? And I'm going to push down, and I'm going to ask you to push up against my arms. Perfect. Nice and strong. Okay, and I'm going to do the same thing to your legs, all right? Push up against me. Good. Okay. You have good strength bilaterally, which means you have equal strength on both sides. You have good free passive and active range of motion, so everything looks good there. I'm just going to finish off by asking you a couple questions from our Morse fall risk, okay? Do you have a history of falling within the past 3 months?
No, I don't.
Okay. And do you have any conditions that you've been diagnosed with related to your mobility?
No.
Okay. Do you use any mobility aids like a walker or a cane or crutches?
No.
Okay. Do you usually receive medications through an IV, like a needle in your arm?
No.
No? Okay. So you don't have a heparin lock. And I noticed by your gait when you were walking in that it doesn't seem like you have any weakness on either side. It seems like you have a strong gait, and I don't see any impairment in the way that you're walking. And would you agree that you get around pretty well?
Yeah.
Okay. You don't have any issues with falling or staying upright or keeping your balance?
No.
Okay. Perfect. So that means you score a 0 on the fall scale, which, don't worry, is a good thing because it means you are at no risk of falls. All right. So thank you very much, Talon. That concludes my assessment today. I appreciate your cooperation.
Thank you.